Okay, we will go ahead and get started today. It has been several weeks since we've all been together, so it's kind of nice to have this little quick spot in our routine Friday morning. With that said, go ahead and put on your calendars. We will have our next call on the 16th of July. There will be an email blast sent out. We'll make sure that reminder's there. It's posted on our website. So no, July 16th will be the next call. And since it has been a few weeks, just a quick reminder, when you're submitting your questions, make sure that you do not, that's a not, send them to the host only. You can send them to host and panelists or all panelists. Just want to make sure that those questions get to the entire team of folks that are on here. And we do have quite a few items on today's agenda, so I am going to go ahead and turn that over to Jess.
Thanks, Heike. Can you hear me okay?
Yes.
Awesome. Good morning, everyone. Happy Friday. The sun's out here. It was pouring down rain, so hopefully wherever you're at, the sun is out as well. And I had just a few updates I wanted to provide first, and then I will turn it over to Carrie Tessero, who's going to provide some updated COVID information. And as Heike mentioned, we do have a full agenda today. So I wanted to give an update regarding budget. And normally we are at a place when we're at the last week of June where we're pretty certain about what's going to happen on July 1st. However, that is not the case, as most of all of you are probably aware. So I wanted to talk just through for a minute what that means for our division and the programs that we provide. So in the news, you've probably seen that there is a special session right now. The governor called that special session on Tuesday, and he held a press conference regarding the issue on Monday. So the special session is to address the federal reimbursement allowance, the FRA, and the extension of that. If you're not familiar, the FRA is a provider tax that leads to an influx of a large amount of funding into the state's Medicaid program in general. So a very important issue. And when the governor held the press conference on Monday, he did explain that if the General Assembly was unable to pass an FRA extension prior to July 1st, then there would need to be expenditure restrictions within the state budget. I will talk through just briefly what those are for DD, and I say them in that just for your awareness, and of course we are all watching closely and hoping that none of this has to happen, that FRA passes, and there's no need to have any expenditure restrictions. But just for your awareness, the items that are in the potential expenditure restrictions were FRA not to pass, that were originally included in the budget to begin July 1st, are the rate standardizations for ResHab, and that's $166 million. The day habilitation provider rate increase for $6.1 million. The funding for the Kansas City Transition Academy, that's $50,000. The in-home rate increase, the personal assistant provider rate increase of $28.6 million. That includes both Department of Health and Senior Services personal care, as well as the PA authorized through DD. It also includes the autism services rate increase for $953,000. And lastly, affecting our division is the hospital reimbursement for individuals who are in a hospital stay because they are not able to find a provider, but the hospital is not being reimbursed for their care because they are just waiting on a provider. So that was in the amount of $2 million. So that is just for your awareness. I will post or put the link to the potential expenditure restrictions document in the chat, just so you have that in case you have not seen it. And we will continue to keep everyone updated as we all watch very closely in high hopes that the FRA does pass and there will be no need for expenditure restrictions. But it is important to also know that several of the items that we are included in DD's budget are funded through, namely all the rate increases are funded through the Home and Community-Based Services Enhanced FMAP Fund that was passed as a part of the American Rescue Act, and that guidance came out from CMS. I've mentioned, I think, on a previous call and in previous conversations with many of you that the guidance that came out from CMS indicated any spending of the enhanced FMAP dollars would need to be approved by CMS. So we will be keeping everyone updated on exactly what that means. We're trying to iron out the answers while we're also waiting on what happens with the FRA. But essentially, we will need CMS approval to spend the funding for rate increases. And so exactly when those will go into effect and whether that will be retroactive is dependent upon the answer that we get from CMS. So we will continue to keep everyone updated on that information. With that, I will turn it over to Carrie for some updates on COVID in Missouri right now.
Carrie, if you are talking, you are on mute.
There we go, double mute, sorry. I was also trying to do 2 calls at once there for a second, so I've now left the other one. I am going to share my screen, if it will let me. You may need to give it to me, Heike, because it's not letting me take it.
And I am trying to be able to do that, so bear with me. I'm not sure why it's not giving me the option.
Okay, let's go with.
I don't have a ball to transfer to you at the moment, but let me continue to work on that while you're presenting.
Okay, I'm gonna try to forward you something if you could pull it up for me, Heike.
Absolutely.
There's a PowerPoint presentation. It's just I apologize for the delay, folks. A little bit of technical difficulties.
While Carrie's working things out, there was a good question in the chat regarding whether waiver funding and funding to remove the wait list, to clear the wait list, was included in the potential expenditure restrictions, or if it was affected by the enhanced FMAP. And I just wanted to let everyone know that verified in the chat as well, that does not affect the base waiver funding or the funding to clear the wait list. So it's only related to the rate increases that were a part of this year's budget, and as well as those other items that I mentioned. So great question.
Okay, so Heike must have got something figured out, because I believe I am sharing my screen now. I think you guys can see a PowerPoint presentation. All right, I'm getting a thumbs up there. So I just wanted to give everyone an update on COVID-19 in Missouri in general, and have some specific discussion about the Delta variant as well, and what we are seeing in Missouri. So what you're seeing now on your screen is what we call our daily situation report. This is put together by the Department of Health and Senior Services. And it has shown, if you look at the main graph here on the screen and you come all the way to this far right, you will see this is for July. So these last few dates here are July 21st. This is the case counts that are reported by each day that are reported out by the department. And you can see we've got this slight upward trend here starting in June. This trend would be much more pronounced if this chart was not showing you everything since the beginning of January. So when you're looking from January with high numbers here and 4,500 cases a day being reported to what we're seeing in June, there's clearly a definite drop. But there has been a very pronounced increase in cases over the last couple of weeks. And as we go through this slide, I'll point out some things here. This average total daily cases per 100,000 is at 11.1. Yesterday, that was 10. And a couple of days before that, it was 8. And a couple of weeks ago, it was 4. So that has gone up pretty significantly just in the last couple of weeks. Our average PCR cases over a 7-day period has been 476 for PCR. 202 is what we're showing for antigen, and those are our rapid tests. So to know how many cases we're getting on average on a day, you add those together. So that puts us about 700 or so cases there. When you add those two together, there were 890 that were added since yesterday. On yesterday's report, the report for June 24th, that number was 1,280. On average, for the last 7 days, we've been about 650 cases are added each day. Just a couple of weeks ago, that number was in the 300s. We were seeing on average 300 new cases a day. So we have doubled in just a couple of weeks, and the numbers keep going up. The other concern is our positivity rate. So here, this is backdated a little bit because they try to get as many test results in as they can to get a better idea of what those test results are. So on that first one, that is for 1 day, that is for June 19th, and we are seeing a positivity of 9.9%. That is up significantly from what we were seeing a couple of weeks ago when our positivity rate was hovering somewhere between 4 and 5%. It's also being reflected in our 7-day averages. These numbers are up as well. The antigen test is at 5.5%. Those are your rapid tests. And then the PCR tests are at 6.9%. Those numbers are also up pretty significantly from where they were just a couple of weeks ago. So we are leading the country right now. Missouri is ranked highest for the number of new COVID infections per 100,000 population. What you're seeing here on this map are areas where we would consider hotspots around the state. And I will preface this by saying both of these areas that you're looking at, the northwest and north central Missouri, as well as southwest Missouri, and now moving really into south central and central Missouri, the Delta variant has been detected in these areas. The darker the purple on this map, the higher the number of new cases per 100,000. And so just want to give a little bit of background on what we're seeing here in Missouri and in these counties, and then I will talk a little bit specifically about the Delta variant itself. So starting up with Northwest and North Central, about a little over a month ago, right around Mother's Day, in Lynn and Livingston counties, we started seeing some, for them, some pretty big jumps in COVID new cases. And it was linked to Mother's Day celebrations, graduations, end of school year activities, contacts traced back to a few individuals who were symptomatic. Some didn't realize that they had COVID. Some may have realized that they had COVID but didn't think it was a big deal, so continued in those activities. And then segued straight into graduations, Memorial Day celebrations, etc. With those activities that were going on in many of those counties and areas and communities, much like the rest of the state, we significantly stopped with our mitigation efforts. So by and large, all mask wearing has pretty much stopped in many places, indoors and outdoors. Lots of gatherings with people from multiple households. Pretty much no social distancing or not a lot of social distancing going on. And in those scenarios, in addition to to that, to our behaviors, low rates of vaccinations in those counties. Many of them at that point in time, less than 30% of individuals had initiated vaccinations. And then thrown into that perfect storm was the Delta variant, which is much more infectious than the Alpha variant. And for those who are unfamiliar, the Delta variant is the one first detected in India. The Alpha variant was first detected in the UK. Both of those variants are significantly more infectious than the original strain of COVID. And again, we'll talk about that in just a minute. So the significance of that is we really saw things kind of heating up and taking off in Lynn and Livingston counties. And then we pretty quickly saw it spreading to their surrounding counties, based both on our traffic patterns, our work patterns, where we're going back and forth. That virus definitely spread. And as a teaser and to answer the question, overwhelmingly, people contracting this are unvaccinated. So there have been some breakthrough infections for vaccinated individuals, which we'll talk about again in just a moment, but overwhelmingly, these new infections are unvaccinated individuals. The hospitalizations are unvaccinated individuals, and unfortunately, the individuals who are losing the battle against COVID are also unvaccinated individuals. So, like I said, we have seen it spread to these other communities. We have been, as a state, working to increase vaccinations in these areas. While this was going on, there's been a couple of trends that we watched in Livingston County and Lynn counties. Like I said, they started about mid-May when we saw those numbers going up. Just about a couple of weeks ago, we started to see a somewhat downward trend, thinking that maybe it was running its course to some extent, but then the numbers went back up pretty significantly the following week. And so we're kind of sitting there right now this week. The numbers seem to be down somewhat in Lynn and Livingston, but because we've seen this before, we're not overly confident that they will start to see a real downward trend. And even if we do in Lynn and Livingston, we're seeing upward trends in some of these surrounding counties. So then coming down here to Southwest Missouri, same story, different location of the state. So again, it really started, and Greene County was not this dark purple even on yesterday's report. It was the lighter purple, but we know that these case numbers are going up. Started in really Taney County and Lawrence County, and Polk County, where it was really kind of igniting in this area. But again, with traffic patterns and work commuting patterns, it has spread pretty rapidly. The bigger concern with the southwest portion of the state is it has a significantly higher population than northwest and north central Missouri. So while we care just as much for each individual person here in these areas, when you're looking at things like fueling that overall transmission and the stress and strain on healthcare resources, Southwest is a much bigger concern because they are driving, it's just more people, more numbers. The hospitals can't necessarily handle at some point the level of infections and the number of individuals that are becoming ill from COVID-19. So we have seen the same thing here, and the demographics of these areas are very similar in that very low vaccination rates. This section here in Southwest Missouri has some of the lowest vaccination rates in all of Missouri. Some of these far southwestern counties, when I checked, which I haven't checked since last week, so the numbers could change, but some of them were still below 20% for individuals who have initiated vaccine. So very, very low initiation rates, despite the vaccine is readily available. We are seeing the same things spreading to all of these surrounding counties. A couple of things to note about Springfield in particular and the Springfield hospital system. Their hospitalization rates have nearly tripled in just the last 2 weeks. So during the epidemic, the pandemic, in the fall, if everyone recalls, October, November, December were probably our worst months in Missouri for hospitalization. Springfield is starting to become on par with that, with the number of people going to the hospital. They had closed down several of their overflow COVID units, if you will. They're opening them back up. Their ICUs are filling back up. They have honestly tripled their COVID hospitalizations A few weeks ago, they were less than 100, so they doubled. And a couple of weeks, or a week or so ago, they were at about 200 admissions. They are sitting at 300 admissions now. And that's just been in the last 2 to 3 weeks. So that is what we are seeing, and again, spreading on upwards into central Missouri. So now to talk a little bit about the Delta variant in particular, and I will tell you, Delta variant has been detected. It is absolutely the Delta variant. The Delta variant is driving this in the southwest portion of the state. They are currently, from I think some of the data I was just looking at today, the Delta variant infections in southwest Missouri account for about 40% of all Delta variants in Missouri infections that are being detected. So some of the things to talk about in regards to the Delta variant. I'll have to start with the Alpha variant first because I want to make sure everyone kind of understands we've seen this before and this is what we are now experiencing in Missouri. And I will talk about the United Kingdom. So we kind of all remember going back several months when the United Kingdom first had what everyone kind of called their second wave. Lots and lots and lots of infections. It was, they went back into their lockdowns, et cetera. That occurred because the Alpha variant, which was significantly more infectious than the original strain, started spreading in the UK. The Alpha variant has been determined to be somewhere between 30 and 60% more infectious than the original strain. It very quickly became the dominant strain in the United Kingdom. Several weeks after that occurred in the United Kingdom, the Alpha variant was detected in the US, very, very much more infectious, spread very quickly. The Alpha variant is currently the dominant strain in both Missouri and the United States. So for Missouri, it counts somewhere between 75 and 80% of our cases. We then saw this latest round in the United Kingdom where they again pulled back and did more restrictive measures. It was due to the Delta variant spreading in the UK. The Delta variant has been determined to be somewhere between 30 to 50% more infectious than the Alpha variant. So it's incredibly more infectious than the original strain that worked its way through Missouri through most of 2020. The Delta variant, as I had indicated, has been detected in the US and in Missouri. It's currently estimated to account for roughly 20% of the cases throughout the United States, which means it probably is accounting for somewhere between 20% of cases in Missouri. So somewhere between 15 and 20% most likely. I say most likely because we don't sequence every single positive case. But we do know it's here. We have sequenced it. It has been detected. In addition to that, Missouri does a lot of wastewater testing and around different communities because you can detect the presence of COVID in wastewater and you can detect if there's a lot of it or if there's a little of it. And they have been sequencing that wastewater, so now they're able to detect which type of COVID is spreading. And I share that with you because last week they sequenced wastewater samples from 30 communities around the state. The Delta variant was detected in 27 of them. So it is clearly here. It is clearly spread throughout a good portion of the state. Some of the things that we're seeing with the Delta variant in particular, and again, I stress over and over and over, overwhelmingly, the things I'm going to talk about with the Delta variant, it is the risk to unvaccinated people. Our vaccines are working quite well against the Delta variant, the Alpha variant, all of the variants. They're not as effective, but it's a difference between with the Pfizer vaccine, that the original strain, it prevented 94% of infections. With the Delta variant, it's preventing 92% or 90%. I mean, it's still a very, very good effectiveness of those vaccines, even against the variants. With that being said, the Delta variant is causing essentially double the hospitalizations that we saw with the previous strains of COVID. And obviously, when folks go into the hospital, they don't always win their battle with COVID. So I would expect to see death rates potentially go up based on that. Some of the things to be aware of with the Delta variant, the most common symptoms, at least initially, are headache, sore throat, runny nose, and fever, which is a little bit different than those other strains. And it's also a little bit easier to perhaps disregard those initial symptoms because that could be strep throat. That could be my allergies. That could be a whole host of things. Those are pretty benign initial symptoms, which could be why this is considered to be so much more infectious, because people are not recognizing or thinking that those symptoms mean they have COVID, and therefore they're not taking the steps they need to take to make sure they're not exposing others. So it is very important to be aware of those. As far as, let's see, I'm going through my list. So we've talked about hospitalizations. We've talked about the vaccines are working against this. They're working very, very well. They have had some discussions about the booster vaccines and whether we will need them. The CDC met yesterday, the group that reviews and approves vaccines. And at this point in time, for a couple of different reasons, they are not recommending widespread boosters for folks. And the first reason, again, take you through the history of the vaccine just a little bit, our brief history of the whole 6 months or so that vaccines have been available. When the vaccines first came out, the experts, the scientists were unsure of how long the immunity would last from the vaccines, but they were hopeful that it would be a fairly durable vaccine, with a worst case scenario being that you would need one every year, like a flu shot. As we're going through and progressing through this pandemic, and they're monitoring and checking folks and seeing how many people, what is that immunity level? Is it staying really robust for folks? They're getting good news almost every time they do those checks and they run that data and they pull that out. So as maybe even just a few weeks ago or a month ago, there was a lot of talk about, oh, we're going to have boosters and we're going to have them sooner than we thought. That was primarily being driven by the concern that the variants would not be, or would be able to escape the vaccine. With the data that's come out just this week and last week, they're finding that not to be the case. So we're getting study after study after study from multiple places, both US data, UK data, Israel, Germany, all of these different places. Everybody is still studying this very, very carefully. So like I said, new studies come out every day. And with each study that comes out, it's showing over and over again that the vaccine immunity is remaining very robust. So what they're considering the 6-month post-vaccination studies that have just come out have shown that people have a very robust immunity still to the COVID-19 virus, and that is only furthering their belief that the vaccine is providing a longer-lasting immunity. In addition, it's doing a very, very good job against the variants at this point. Still a very, very good job. And so when they take those two pieces of information together, the recommendation as of this week is we probably do not need wide-scale boosters starting as early as 12 months from when you got your first one. Now, that being said, there are some caveats that we need to understand. The first one is immunocompromised individuals. And this is really important because many of us serve people who fit into this category. So the first thing to be aware of is vaccines for everyone is absolutely 100% still our best course of defense against this virus. However, individuals who have a faulty immune system for whatever reason, perhaps they have some sort of condition that causes their immune system to not work, or perhaps they are taking some very powerful immune suppressant medications. These individuals may not produce the same immune response from the vaccine as someone who did not have these conditions or take this medication. So some folks, if I'm saying you get your vaccine and you don't have any immunocompromised things and you would get up to about that 94% protection from the original strain, an immunocompromised person may only come up to 75%, or they may only come up to 50%. Those are still good protective measures for people, but we need to understand they don't have that same full immunity. So what does that mean for those people if we're caring for them? It means we need to be a little more careful. If we know that they are on those immunosuppressant medications, or we know that they have these conditions, instead of just saying, okay, you're vaccinated, you're fully vaccinated, that's great, you're protected, throw away the mask, let's go do whatever we want, we should probably meet somewhere in the middle between doing that and keeping them in a bubble. We don't want to keep people in bubbles. So it means wear that mask when you're going, if you can, wear that mask if you're going out on an outing, even if you're fully vaccinated. I don't have those conditions, I still wear my mask when I go out into the grocery store or places with lots of crowds. It means maybe we still do some social distancing, you know. We don't have to sit 5 inches apart from each other. Maybe we still sit a couple feet apart when we're talking and interacting. Maybe we try to do as many things as we can still outside because it is safer. So when we have individuals who we know are on those powerful immunosuppressants or they have those underlying conditions, we just need to be a little bit more careful with those folks. There are a handful of individuals that have not produced any immune response from the vaccine. Most of the time, these individuals are on multiple powerful immunosuppressant medications. Maybe they're on cancer treatment. Maybe they are suffering from HIV/AIDS and their immune system is pretty much depleted. So it is possible for some folks in that category. That group of people will most likely be the first ones that they recommend boosters for, but we're still not there even for some of those folks. So I wanted to share that and make sure that people were very well aware of that. And I will kind of pause here and see if there are any questions. And then I want to talk a little bit about some data specifically to our DD community.
Carrie, there were a couple of questions that popped up, but they were really more related to the response administratively by the division and not with details regarding the actual COVID vaccine or what we're seeing. So I wanted to address those just real quickly so you can get to the rest of the information. But one of them was regarding for our, in particular, DD staff, and that was remote work and whether we should be in the office right now. So just wanted to make sure that everyone on our team is aware that although the governor has implemented the return to the office order, we continue to work with leadership at DMH and HR, and our HR are continuing to work with our Office of Administration personnel to go down the path of remote work and distributed work teams. And so we have been working on putting together information to move that direction in the future. And so that is being reviewed by Office of Administration, and they're telling us what information they need. So I just wanted to make sure staff know that we recognize that and are continuing to move in that direction. So we want to encourage everyone to be as vigilant as possible in the office and both in the community, given the circumstances right now. And the other question that came up was regarding in-person monitoring and whether we're currently watching that, whether that would move back to remote. It is something that we're watching very closely as of right now, and we will get the map updated regarding case management county status just to reflect the current date. And of course, send out any notices if anything changes. Right now, all of the counties will remain in-person monitoring. We were weighing the risks and the benefits of in-person monitoring versus remote, and we came to the conclusion that it is a very low-risk transmission activity of doing an in-person monitoring visit, and it can be accomplished at an extremely low risk. But the benefit of having eyes on an individual who is vulnerable to ensure their health, safety, and welfare can be accomplished in a very short amount of time in an open air environment. And we are encouraging providers to, of course, look at all of the risk factors. When making the decision, we're encouraging them to do an open air, if at all possible, to spend a small amount of time in the in-person environment, 5 to 10 minutes, making sure that you see them, are able to see maybe even through a screen and touch base with them, and then maybe do the remainder of the monitoring in a remote type environment. So just wanted to say that if that changes, we're continually monitoring it, and if that changes, we will update the map And then we will also send out a blast of information via the listserv. So, Carrie, back to you.
Thanks, Jess. I just kind of want to follow up on what Jess was saying as far as the low-risk environment. The screening tools that the Division of Developmental Disabilities put out to help in planning those visits and asking those questions are incredibly helpful, and I would encourage everyone to use it every single time for when making your determinations of when and how to do those visits. And, you know, as Jess said, you can do that actual visual inspection of the living environment in just a few minutes. And then if you saw things of concern, even while you were there, when you go into that open air portion of it, doing it outside or through a door, then you can ask questions about what your concerns were while being outside and still being 6 feet apart. Obviously, I would recommend wearing masks when going out in the community. And I also cannot stress enough that the greatest risk is to those who are unvaccinated. Over and over and over and over again, the people who are winding up in the hospital and contracting COVID with the Delta variants, even if you have been vaccinated and you're contracting COVID, you are still, for the most part, folks are not getting very, very ill, which I know no one wants to get it at all, and I totally agree with that. But these are very, very low-risk activities if you use the precautions that we've all lined out to do them with. And then I do want to show you some information on, oh, it's on the wrong screen. Let me pull it over. On our data as far as how we are doing with individuals. So I'm not sure how big this is that you guys can see or not see, but what you're looking at is a spreadsheet that is comparing our DMH-DD participants and their vaccination rates. And this is about a month old again, because we just got this at the beginning of June. So we're making some significant progress. And we compared to where we were in April with our individuals. And we have looked at it by age group, we have looked at it by region, and we have looked at it by service type. So when you just look in total by our age groups, in April, we had almost 42% of our DMH participants had initiated vaccine, with 30% being completed. For June, that had gone up, and we have almost 37% of individuals who have completed vaccination. I want to point out, can't point this out strongly enough, this is from the very beginning of June, so we have another 2 or 3 weeks worth of data to put in here, and I will follow that up by saying I just received information yesterday from the Department of Health that in Webster County, because of what we're talking about with the Delta variant, they just had a vaccination event for individuals for our DD community, and they vaccinated over 100 individuals. And so that was fantastic. So we are still making progress. When you look at it by age category, and these numbers aren't 100% comparable from April to June for a number of reasons. The first one being we may have had more people come into our services between April and June, so that can push our numbers up. The second one, when looking at it by age group, we could have had people who had birthdays and switched age groups. And then the third reason is in April, 12 and 15-year-olds weren't eligible for vaccine. So when looking at that 18 and older, we were able to go from 32.5% of individuals had completed vaccine to 43% had completed vaccine. So that's really good. The 16 and 17-year-olds made some pretty big progress from 5.4% to 12.5%. And then the 12 to 15-year-olds were just getting started. Lots of people still are hesitant or did not really realize, even at the beginning of June, that 12 to 15-year-olds could become vaccinated because that was just put out there. As far as by service type, where we touch people the most and have the most interaction, we have our highest rates of vaccination. And so that's a good thing. But we also want to get further into those other groups. So when you look at residential, our residential numbers are really, really good. Very happy to see that from April to June, we've gone from 64, almost 65% initiated to over 70% had initiated vaccine in our residential settings, and gone from almost 52% completed to almost 60% completed vaccination. That was as of the beginning of June. So we do know that we're still making progress in this area, but those are really good numbers. Community, not quite as strong as residential, but we are making progress there. We have 34% of individuals have completed vaccine. Case management is really kind of where we have the least amount of interaction with individuals. And I would encourage even our case management agencies to bring up vaccination when you're having your meetings with folks, even if it is annually, or to send information out through your distribution list to those that you serve, so that they know that, to make sure that they are aware that the vaccines are there, that they are safe, that they are effective, that they are available to them, and where and how they can access them. And if you need help with that kind of messaging, you can reach out to us at the department, and we will try to help put some stuff together for you. As far as those that are 18 and younger, you can only get the Pfizer vaccine at this point. There is a feature on the covidvaccine.mo.gov website that allows you to find vaccine, and you can find it by type. So if you have a 15-year-old who can only get Pfizer and you've been struggling to figure out how to get them vaccinated, you can go to that website and it will tell you exactly which pharmacies in your area, your zip code, or doctor's office, et cetera, have Pfizer on hand that they can get you vaccinated. So they can take the legwork out of that for folks. So if that's something you're running into with people that you're serving, there's a tool out there to help you, and we can get that to you as well. When you look at the information by regional office, the trends within our population reflect the trends of the state. It's just as simple as that. So we definitely are doing better in some areas of the state than others. And in particular, the Springfield area, the southwest portion of the state, doing pretty low. Southeast is also a bit lower than what we're seeing in some of the metro areas, such as Kansas City, St. Louis, and Boone County. And so we can also use the southwest and the north central, northwest portions of the state as our canary in the coal mine, if you will. We know this migrates. We see it migrate. We know it goes down the highway with all of our friends and family. So knowing that we have low vaccination rates in the southeast portion of the state as well, you can expect it to be coming your way in the next couple of weeks, particularly with the July 4th holiday coming along. We have seen it with every single holiday or event. There has been a bump in cases afterwards, and knowing that Delta is already circulating, and knowing that we have pockets of the state that still have pretty low vaccination rates where it hasn't really taken off, it's just a matter of time before it makes its way through there and before the Delta variant becomes the dominant variant in our strain that is circulating through all of Missouri. So with that, I would strongly encourage anyone who is maybe has been waiting for additional data and information to make a decision, or who is thinking, yeah, I'm going to get it, just not yet. Now is definitely the time. It is available at pretty much any pharmacy around the state. It is very easy. You can go in and make an appointment to make sure you get in and out. Most places you can also just walk right in and get your shot with little to no waiting. So I would strongly encourage folks to go ahead and get that vaccine. And I would strongly encourage, if that's something that you do want to do, that you do it before the 4th of July and before all of those activities go. It will not provide you with 100% protection at that point, or the high rate of protection. You really need that second dose if you get the 2-dose series to get up to that level. But it does provide you with some protection. And even those who have some protection are faring better against this virus if they contract it. We have shared this information with some of our local public health agency groups, and many of them are the representatives for what's called the Vaccine Regional Implementation Teams. And we will also be sharing with them a list of the DMH contracted providers with contact information and addresses. So they may be reaching out to some of you and to different facilities to discuss specific vaccination events geared to individuals with developmental and intellectual disabilities. They may be reaching out to discuss information and outreach. How is the best way to talk with some folks or to get the information out to our community so that people understand the need for the vaccine, as well as make it easy as possible for them to actually access the vaccine. So don't be surprised if you get a phone call or you begin to see stuff in your area about these specific outreach efforts. And that is really all I have, unless anyone has any other questions.
Carrie, thank you so much for this great information. Very, very timely. Appreciate everything. And we did not have any more questions that came in through the chat. So right now, I'd like to turn it over to our partners at Station MD for some great information and updates. Thanks.
Thank you. Thanks for having me. I'm Malik Trivedi. I'm one of the physicians with Station MD, and we had two main issues I wanted to address. And first of all, I just want to say that was a fantastic overview of what's going on. And I'm actually going to touch on some of that, and a lot of what I was going to talk about was already covered. So thank you so much for that kind of overview of what's going on with the Delta variant. It does kind of tie into what I'm going to discuss. The first issue was, we've heard from some providers that, as COVID is waning, not to use Station MD or specifically when to use Station MD and for what reasons. Well, as you've just heard, it is not waning. There is this Delta variant, and I concur with everything that Carrie had mentioned. One other thing I will add, a few other things is, this is a moving target. This is literally breaking every hour. There's a new story about this. I just recently was following some information from CDC in Israel, who has dropped their mask mandate 10 days ago, and they're reinstituting the mask mandate because the cases of Delta variant COVID are surging. There's a lot of COVID fatigue. None more than me, I'll tell you, working in the hospital, we see it all the time, and it's easy to kind of get a little lax. But I really feel, if anything, we're in the home stretch here, and this is a little bump in the road with this Delta variant. The things that I would emphasize is, number one, COVID is not gone. It's still there, okay? Regular COVID, Alpha variant, there's a Delta plus variant. It is still out there, and your best protection against it is a vaccine. The latest information from Israel showed that of the cases of people that got COVID that were vaccinated, majority of them were mild illnesses as opposed to being hospitalized, and so that's number one. Number two, what's pertinent for us in this specific meeting in our population is individuals with IDD are more vulnerable to this virus. There was a study in the New England Journal of Medicine which showed that outside of age, having an intellectual disability was the highest independent risk factor for contracting COVID and dying from COVID. Extremely alarming when you think about it. So, if you're on the fence, or individuals are on the fence, or are not sure about getting this vaccine, this is even more reason to get vaccinated. And then also, as was mentioned, all the more reason to continue masking if you possibly can. It's something that adversely affects this population. And as you know, as you've heard, hospital cases are increasing. If you want to be exposed to the virus, go to a hospital, because that's where it is. Go to a healthcare setting. Anything we can do to mitigate people going out to these kind of settings as they increase their volume and they get to capacity, we should do. And so that kind of piggybacks into what I wanted to talk about with Station MD on when to call us. Anything, any issues, any questions around COVID, any concerns you have, if you just need to get a med refill, you can call us 24/7. We are still available. This is not just for the individual that we want to keep safe, but it also involves DSPs that have to go with the individual to the hospital and travel with them, or a family member. This is important for everyone. But again, I want to emphasize that we are there as a resource. I know everyone's tired with COVID, but if you have a question, or who needs to be, was exposed and where do you put them, we are there. There's no specific question that you can't use us for. So just wanted to address that we are still there. We're still on. We're a resource for you in terms of COVID, but also not COVID. Falls, seizures, med refill, rash, whatever you need, we are there. You can call us. And if you have questions about anything, you can also reach out to us, and we can help clarify that. In addition to that, I want to just let you know that we will be sending out a few mailers to you, just to give kind of a one-pager on information you can share with DSPs, or anybody who is a formal or informal support staff caregiver on when to call us. That should be going out shortly. And just want to let you know that with this recent surge that we're seeing in Delta variants, from a medical perspective, we really feel as a physician, and from what I'm speaking to my colleagues, that this will be the dominant variant that will be out there. The good thing is the vaccine is effective against severe illness. And I'm actually going to, I think if I can put in the chat box, I'm going to put in a link. Hopefully I can send this to everyone. This was a webinar that we did. It's on YouTube. You should be able to get it. Let me see if I can. I'll see if I can do it. If not, I'll share it with the group. But just it's a webinar that we did, Station MD doctors, very informal, specifically geared towards the individuals with IDD in the community, with a Q&A about the vaccines, what the questions are, where the concerns were. This was done a few months ago, so obviously we are not addressing the Delta variant specifically, but it kind of talks about why people are getting it, why aren't people getting it, why we got it for ourselves, for our family. So if you yourself or someone is still not sure or wants to get some more information, there's a lot of noise out there, I understand, but these are 3 doctors that we deal with this on a daily basis. So I'll see if I can get in the chat, and I believe, just want to check my notes. I had nothing else to speak of, but I think there's a question in the chat, or maybe not. I'm not sure. There's a few questions, I guess.
Yeah, thank you.
Sure.
There was a question regarding whether if guardians are unsure about their loved one getting the vaccine, they call Station MD to discuss.
Yes, and we're happy to talk. I mean, it's hard to have a full discussion about that, but we've had those discussions. And you could even refer them to this webinar because that's an issue. Look, we've even had some physicians say, you're not at risk, you don't need the vaccine, and we think otherwise. But we're happy to talk to people about if they have specific concerns about the vaccine. Sure.
Awesome, thank you. Yeah, we would definitely encourage really any question that you have. There was another question specifically related to the Delta variant and whether we're seeing kids getting the Delta variant more often since they cannot get vaccinated yet.
Yeah, so what I am hearing, and again, this is all fast moving, the Delta variant is spread to, I believe, 70 countries. And so some of the data that I've seen, for example, in England or maybe it was Israel, is that, yeah, a lot of kids were still getting it because they weren't vaccinated. Again, the severity of the illness, though, was low. And even individuals that were vaccinated that got it, very, very small percentage of them got severe illness, severe COVID. But the short answer is yes, that it was infecting children. And largely, I don't think it was because they were children. It was just because they just happened to be unvaccinated. And that's why I think that would address the other topic, which I couldn't tell you when, but when they're going to open this vaccination up to children under 12. I think that's the next logical step. Of course, there's always concern about safety and that, but I think if anything, this is going to motivate people to push that up further because that's a big aspect of this spread. Again, not to beat a dead horse, and I know everyone's tired about this, but this Delta variant and Delta Plus variant are mainly ravaging pockets and individuals that are not vaccinated. And so that's why if there's anything you can do, get vaccinated or tell your loved ones to get vaccinated and continue masking if you can.
So just to follow up on that a little bit, Jess, as far as Delta variant and younger individuals, they have seen both in India and we are seeing here in the U.S. as well, that the Delta variant has been causing more severe illness in both young adults and in teenagers and children as well. So more are contracting because they're unvaccinated, but also just in general, more kids contract the Delta variant than they did the original strain. They're not 100% sure why that is the case, but they have been seeing that. Now, 2 things are going on here in Missouri in particular as far as younger people and the Delta variant. One, by far, those age 50 and over in Missouri have the highest rates of vaccination. For a couple of reasons. One, we prioritize those groups at the very beginning, and 2, they were willing to be vaccinated. So we have very high vaccination rates among individuals ages 50 and over in Missouri. At 65 and over, many of them are at 70% or higher for their vaccination rates. The second thing regarding those younger folks, when we're looking at our hospitalizations now, partly because we do have high vaccination rates for those 65 and older and higher rates at 50 and older, many of the folks going into the hospital, while they are overwhelmingly unvaccinated, we are seeing more and more people being hospitalized that are in their 40s, their 20s, their 30s, even some teenagers, and on occasion some children. And they're seeing, particularly if you are unvaccinated, those going to the hospital, many of them needing ICU level of care. So those are all things to be aware of, and we do need to do a better job of getting our younger folks vaccinated, even those in our 20s or 30s. The other thing, as far as children 12 and under, when will they be vaccinated? Pfizer has already requested emergency approval for those between the ages of 5 and 12. Moderna, if they have not submitted it, they will be submitting it fairly soon. So the FDA and the CDC folks, all of those who review those requests, who review that data, are in that process now. And the hope is that they will have emergency authorization for those between the ages of 5 and 12 at or before September. So they're really wanting to get that opened up before school starts in the fall. So those things, they are looking through it now. The data from their clinical trials was very, very good on Pfizer for those between the ages of 5 and 12. They had very high levels of immune response. They had fewer side effects recorded even than with adults. So that was really good news, but they're going through that same process that we do with everything. We're looking at the safety data and all of the things that were collected and doing that really thorough review before they do that authorization. And then as far as people, can they spread the Delta variant, or people who've been vaccinated, are they spreading COVID to others? That's still a little bit up in the air. They get more and more data every time that they look at it that indicates people who have been vaccinated that contract COVID obviously have very much less severe disease, or they're asymptomatic. Typically, when you are asymptomatic or very mildly symptomatic, you have lower viral loads. Typically, if you have lower viral loads, you have less chances of spreading it. So the data is showing that it's looking more and more like, even if an individual who is vaccinated has contracted COVID, they're using the phrase they are less likely to spread it to others, but they're not at a point where they're ready to say that they don't spread it to others. It's just that they are much less likely to spread it to others. As far as people who have already had COVID and those who are unvaccinated, is there data on those individuals contracting the Delta variant? Yeah, there have been a number of people. We know people can get COVID again, and we know that if you've had the original strain, that there is potential that you could even catch the original strain again, but you could catch the Delta variant as well. That's not a guarantee. You do get some natural immunity and some protection from having COVID, but they're just not sure how well they interact and prevent you from getting these additional strains. There has been data to show that the vaccines provide what they believe to be longer lasting immunity, and that they provide better protection against all the strains than even if you've had COVID. So they do recommend individuals who have had COVID to still be vaccinated. It is still your best chance of preventing a reinfection or preventing an infection with a different strain. And I'd also say, COVID is just a very unique virus. It attacks everyone differently. So one person can get it and have no symptoms, another person can get it and unfortunately pass away. And you have every scenario in between those two. And so we see the same things with reinfection. There have been some individuals who got COVID, it was mild, they recovered, they were fine. Then several months later, they got COVID and they wound up in the hospital. And we've seen the opposite. There have been people who've gotten COVID, been very, very sick, recovered, and then they get COVID and they don't get very, very sick. Or they got very, very sick both times. So it's just very unique how these things affect each individual. And that is another reason that they recommend our best defense, even if you've had COVID, is to get vaccinated.
Thank you, Carrie. I really appreciate it. Thank you, Dr. Trivedi. We are out of time, and so I just want to thank everyone for joining us on the call today, and we hope you have a great holiday, and we will see you next month.
Thank you. Bye-bye.